Hi, I'm Dr. Yusof from Leeds, UK, reporting for Room Now for EULAR 2021. I'm delighted to be joined by Dr. Sabih Ul Hassan from University of Leeds, UK, who just presented an oral presentation on Wednesday, 2nd of June, 2021, abstract number OP0044. Hi, Dr. Hassan.
Hello.
Okay. So first and foremost, can you please describe what were the objective of your study?
Yep. So the study's objectives were to see whether in a cohort of ANA positive patients, what would be the outcome if we followed them up for a number of years, so 3 years to be precise in this case. Second, could we predict who is going to develop an autoimmune condition such as lupus or Sjogren's? And three, whether we can somehow identify those patients who don't necessarily need to be followed up for that long, i.e. those patients who are just not going to develop anything clinically significant.
Okay, so this was a prospective longitudinal study of 3 years follow-up of ANA positive individuals. Yeah. So can you please summarize your key findings?
Yep. So firstly, we noticed that there were 5 distinct groups in this, subgroups in this. So firstly, there were 21 people who progressed within the first 12 months of follow-up to actually meeting criteria for one of the autoimmune connective tissue diseases, so namely SLE and Sjogren's in this case. We then had a second group of individuals who developed one of these conditions in the latter half of the study, and then we had those who did not actually meet classification criteria but needed some treatment, whether it was antimalarial or whether it was immunosuppression. And finally, there were patients who did not meet any criteria at all at any time point. And those we called absolute non-progressors. Secondly, we found that interferon scores A and B both predict people who are going to develop autoimmune condition within the first 12 months. And also those amongst the patients who did not meet criteria but did need immunosuppressant medication, they also predicted that. And finally, there were other flow cytometry biomarkers that again correlated quite strongly with those patients who progressed to developing immune conditions within the first year, or those who required immunosuppression such as CD4 T cells and monocytes. And lastly, although those patients we called absolute non-progressors who did not develop any, or did not meet any criteria at any time point, still actually serologically had a lot of abnormalities.
Oh, that's very interesting. So, to conclude, like you mentioned, people who have higher interferon scores and some flow cytometry markers can be used to predict people who do progress meeting criteria or require immunosuppression. But you also saw in a positive individual who not progress, there were also some immune disturbances there. Okay, and so how would how would these findings be applicable to practice?
So I think the first thing would be to not just dismiss people who don't have a sort of a tangible immune condition from the outset. So, practices differ in different centers. You may see, a clinician may see a patient who, has an ANA positive blood test, but nothing much going on. And they may be perhaps too quick to sort of say, well, actually, this person doesn't meet any criteria, they don't need to be seen again. So first recommendation would be to actually try and see patients for at least a year, because it may take as long as that for some of the ones who are going to develop a condition to develop it. Second is that these biomarkers in a more routine setting can actually help predict who's going to develop it. So the next step from this study would be to actually produce risk prediction models, which we would then test and validate to be able to use in routine clinical setting.
Okay, so thank you for offering to be interviewed today.
My pleasure.
Yep, thank you so much. And you can follow me on Twitter. My Twitter handle is at use6yusof. Tune into Room Now for more reports and updates from the conference. Thank you.
Thanks very much. Bye.